Hey Facebook, it's Dr. Sam Price. I am a licensed naturopathic physician. I am an expert in natural medicine. Through my #1 best-selling books, my concierge medical practice, and my live event, Vital the Experience, I help you bridge conventional and alternative medicine to transform your illness into wellness. You will see me talking to 2 separate cameras, so I figured I would get everybody all at the same time. So up here, I'm talking to Instagram, and down here, I'm going to be talking to you guys on Facebook, okay? So today we want to talk about the coronavirus. It's all in the news. I'm sure you have coworkers and friends that are like stressed out about it. Please type in the comments if you're here so that I can say hi to you guys. Thanks for joining me. All right, so the coronavirus, if you guys don't know, happens to be a family of viruses, and some that we already know. So part of the virus family, coronavirus, is the common flu. I mean, the common cold. We get this all the time, right? You might get a sniffle or a sneeze or something like that. Another one that's pretty severe is SARS, severe acute respiratory syndrome, and MERS, which is Middle Eastern or Middle East respiratory syndrome. So coronavirus is a family of different viruses. And COVID-19 is one that's just being discovered, okay? So I want you to understand that it's a family of viruses. We do know about the common cold. We know about SARS. We know about MERS, okay? COVID is just a new one under this family umbrella of coronaviruses. All right, so thanks for joining me, Sean. I am talking about coronavirus today. I am looking at Instagram and also Facebook. Thank Christy for joining me. All right, so what I want to explain to you guys is I thought I would do a demonstration if you don't mind. So your normal cell looks like this. It's nice and smooth, right? If you can see that on Instagram, can you see that? Okay. A virus looks like this. Do you see all those spikes? So those spikes are what the virus uses to actually attach to a mucous membrane. So a mucous membrane, think about, saliva in your mouth, your lungs, your eyes, your nose, things like that. So that's what's it's using to attach it. But you see that the virus doesn't have feet and it doesn't have arms, right? So it can't just walk its way into somebody. It can't just grab onto you, all right? So it can't spread on its own. We need to help it spread. So I'm going to talk about that in a minute. Normally, in a great immune system, you would have antibodies, all right? So we all probably have antibodies to the common cold. Antibodies are our defense system. It's our immune system. It helps to get rid of the viruses and other infections, fungal infections, bacteria, those type of things. What these antibodies do is they come in and they take off these attachments. What's interesting about these little attachments on the viruses, if you guys can you see that they look different? I know Instagram you probably can't, but can you see? All right, so they look different. So depending upon what they look like, so it might be this one goes to the nose, this one goes to the mouth, this one goes to the eye. So it has an affinity for certain areas. Isn't that really cool? Like, I think viruses are really cool. So in knowing that, it might say, hey, I'm going to go attach to your nose. I'm going to go attach to the mouth. All right. Since this is a new virus, the COVID is new, our immune system hasn't seen it yet. So it's taking a little bit longer for it to form the antibodies. That's the reason why you're seeing people be a little bit sick and everybody's all stressed out. We don't know what to do about it. There's no vaccine. There's no treatment for it. Our immune system isn't used to it. It's new. So we haven't formed antibodies to it yet. So that's something that I wanted you guys to know. So the symptoms. If you have the coronavirus, remember this is a family of viruses. So in that family, it looks the same as your common cold, as SARS, so that's a little bit more severe, and MERS, right? So you're going to have fever, maybe, sniffing, runny nose, cough, sneezing, maybe even body aches. What I want you guys to know is don't be afraid of the fever. I've talked about this before, right? So fever is the body's way of ramping up and actually killing the virus, right? So it's okay to have a fever. Please don't do antipyretics. If it gets to be about 104 or something like that, then you can worry about it, all right? Fevers are our body's natural ability to heal itself, all right? So symptoms, once again, you'll have common cold symptoms, body ache, fever, coughing, sneezing. Some of the more severe symptoms are going to be shortness of breath, because what happens is as this little virus goes down to the lung, it actually starts replicating and it makes photocopies of itself. It attaches to your lung cells, and then what it's doing is strangling it. So that's why you're having the shortness of breath. And that's what normally lands you in the ER department. Well, let me just say something really quickly about you guys going to the emergency department, because I have lots of friends that are ER docs, okay? So there are a lot of emergencies that happen all the time. If you have these symptoms, I'm going to suggest that you call the emergency department ahead of time, but call your family physician or your doc first. They might be able to triage you over the phone and know whether or not this is something different. And then they can be prepared for you when you come in. Okay, so call ahead of time. There are no meds to kill this. There are no meds for prevention. Remember, this is something new. What they're going to do for you if you go to the emergency department or an urgent care is they're going to give you oxygen because it's shortness of breath. And they're going to give you fluids because of the shortness of breath, it's hard for you to swallow. So they're going to hydrate you. Okay, so those are some of the details. All right, so let's talk about the spread. Yes, okay. If this is helpful, type in the comments that this is helpful. If you've got questions, type it in and I will try to get to your questions. 1 second. 1 second, please. I forgot that I was going to share with some other people. All right, so you guys share. All right, so let's talk about the spread. It is spread through respiratory droplets. So literally, even being 6 feet away from somebody who's contagious, if they actually sneeze or cough, a droplet can land in your mouth, your nose, or your eyes. All right, that's how you're going to get it. It's spread by respiratory droplets, sneezing, coughing. It could spread if it's on a surface, it's not going to do anything. If you touch the surface and you get the coronavirus on your hand, you're not going to be infected. The virus cannot go through your skin. What happens is you touch your face and the droplet gets in your nose or your mouth or your eyes. That's how you get infected, if that makes sense, okay? It's inhaled into the lungs. So just touching it, you're not going to get the coronavirus. Touching your face, getting it in your mouth, your eyes, that kind of stuff, that's how you're going to get it. 1 second, guys. So if you have any questions, can you please pop them in the chat and I will try to answer them. 1 second. Coronavirus right now. All right, so severe symptoms. Let's talk about the severe symptoms. So remember that this is a family of viruses. Oh, my thing is talking to me. This is a family of viruses. So SARS is one of them. That's severe acute respiratory syndrome. That actually, I think we had, 10% mortality rate when there was SARS? And do you guys remember that? Like, it was a big pandemic. It was really scary and stuff like that. So SARS had a mortality rate of about 10%. Right now, the coronavirus has a mortality rate of 2%. Okay, so not as beefed up. Severe symptoms. All right, so your immune system is depleted or not robust. So you know how they keep talking about the elderly and babies are most at risk? Well, remember I told you that if your immune system isn't robust, then of course you don't have the antibodies that can go and attack these little cells, right? So you're not building the antibodies. So what we mean by the elderly, and I don't even think that above, I don't even think that I lost my train of thought. I don't even think that above 65 is elderly, but they're considering anybody above 65 also immune compromised. So diabetes, COPD, cardiovascular issues, emphysema, immune compromised, right? So their immune system is already battling some other stuff. So they're having to do that. And then on top of that, if they get coronavirus, that's a little bit too much for their system to handle, okay? Babies, let's think about this. Their immune system is still ramping up. They're still getting the whole antibody thing down, right? Plus, what do babies do? They're constantly putting stuff in their mouth. They touch a surface, they're putting it in their mouth, right? So we need to be, which is considered over 65 for some reason, and babies, okay? Masks. I get questions about masks all the time, okay? So here's the deal with the mask. The masks that you guys are buying are actually, they go like this. They do cover your nose, and that's great, but on the side, there's a gap, and so the virus masks are not doing anything. However, if you're sick, that's great, because then the respiratory droplet hopefully stays within the mask. Even if it's not the coronavirus and you just have the flu or coughing or sneezing or whatever, the mask is great. What the mask also might do if you're not sick is it might prevent you from touching your face. You got to make sure you're not touching in your eye because it's only covering your nose and your mouth. So it might prevent you from touching your face. So that might be an idea. The mask that actually is protective is the N95. N95 is the one that healthcare workers are wearing. It is completely sealed, so nothing can get in, nothing gets out either. Okay, so N95 is the one. So what I suggest is, if you have been on a flight to China, or if you think that you may have the coronavirus, you can call your physician, try to get some triage back and forth to see whether or not is this coronavirus, because we really don't have testing. What happens is the CDC has to test it right now. So even if you went in, they would send a sample out to the CDC, which is in Atlanta, for them to test it. There are some states that the CDC is allowing to test, probably Washington at this point, right? So they would need to test it. You can do self-containment for 7 to 14 days. That's usually the incubation period. So 7 to 14 days to just stay inside the house, okay? Cautions. So I normally have my groceries delivered, so I'm not having to be in the grocery store. However, I went to the grocery store to get these cloves to show you guys what this looks like, and I just was like, oh my gosh. Hey, Christy, if someone has asthma, are they more susceptible? Probably so. Respiratory droplets, so that's immune compromised as well. So when I was getting the cloves, I'm watching the bagger lick her finger to open the bag. So I want you to be cautioned with touch screens. So you know how we put our credit card in and then we have to touch the screen, right? Other people have touched that screen. 2, when you're giving your credit card to somebody. So if you give your credit card to, let's say, a drive-through area, that person touched your card, then they gave it back to you. That's another area. Grocery store carts, at least they do have the sanitizers now to do that. Grocery bags, so I just explained that to you. Everybody's handling this grocery bag, so that's back and forth. Gas pumps, guys. Other people are touching the gas pumps. I think this goes without saying. Bathroom. Everything about the bathroom, right? So the stall door, the door to open it, the door to go out, the handles to do the water, paper towels. If they're not automated, you know, you have to scroll down, or either you crank it. So all of that, all of the bathroom is a no-go at this moment. Cabinets. So if you work in an office and you have to open a cabinet or the fax machine or something like that, then I want you guys to be careful about touching other stuff. crowded venues. So instead of you guys wearing a mask, I'm going to suggest that you put some gloves on. So it's really about touching things and then touching your face, right? So gloves are probably a better investment for you guys right now. So you can get a box of gloves from CVS, Walgreens. I don't know if Myers sells them, but go to your local pharmacy and get a box of gloves. Public transportation. So you're holding on to the rails, sitting on the seats and putting your hands on the seats. So public transportation is probably a caution right now. So you guys want to really know about treatment and natural prevention, right? So let's talk about the fact that best cure is prevention so that you don't get it at all. This is a virus. It's a virus. It's just a virus that we're not familiar with. So when we're talking about viruses, there are 7 things that I want you guys to know. So if you guys can type this in the chat, I'd appreciate it. So the best thing you can do is build up your immune system, okay? Number 1 is food as medicine. Food is medicine. So you can always use your food as medicine. Hold on one second. So just recently, I did a podcast on the blood type diet. And the blood type diet is a genetic-based way of you eating that helps to decrease inflammation, which automatically builds up your immune system. So I'm going to put the link in the chat, in the comments box. You can watch that whenever you want to. So, blood type diet, food as medicine, decreases inflammation, builds up your immune system. Food, antioxidants, so berries, blackberries, blueberries, raspberries, strawberries have high antioxidant. They're going to help to build up your antibodies, so they pull out the little sticks on the viruses. Also, decrease your sugar content. So sugar automatically decreases your immune system. And I have to thank Dr. E at Rockwood Natural, because I didn't know this, but each time you have something with sugar in it, it actually decreases your immune system for 4 hours each time you have something with sugar in it, okay? So each time, if you're having something now and then 10 seconds later, then it's another 4 hours. So that's 8 hours. That's a really, really long time to deplete your immune system, especially if you're trying to fight a virus, right? So decrease your sugar consumption. So basically, when you're shopping in the grocery store, shop the perimeter. You don't want to eat processed foods. So your live foods, so your deli section, fish, meat market, your vegetables, your fruits, those things are going to be on the perimeter. So you need to shop the perimeter of the store. Number 2 is to hydrate. You want to flush the toxins out. You want to alkalinize your environment, so alkalinized foods and also alkalinized water. Remember, I told you that what they're going to do for you at the emergency room is they're going to hydrate and they're going to give you oxygen. So hydrate yourself, flush the toxins out, hydrate. So that's number 2. Number 3 is sleep and rest. It's always the best medicine. I preach about this over and over and over again. When you're not getting proper rest, you automatically decrease your immune system. So you can't do 15-hour shifts and then think that you're going to beat the coronavirus or the flu for that matter, or the common cold. So you have to get your proper rest. Number 4 is a neti pot, and I'm not sure if everybody's familiar with this, but you guys can, I didn't actually get a link for that. A neti pot is something that actually cleanses your nasal passage. So remember, I told you that this is spread through respiratory droplets, usually through the nose or the mouth or the eye. So if it's getting in the nose area, if you can grab it and get rid of it before it goes down to the lung, yay! So a neti pot is a little pot that you stick in your nose, and then it cleanses the nasal concha. This whole passage area is called EENT, eyes, ears, nose, and throat, actually goes down into the throat area and then goes down into the lung area, which is affected. So cleaning the nasal passages would be fantastic. So that was number 4. Number 5 are supplements. So supplements, like I've always said, supplement other things. So lifestyle, food choices, exercise, air, sleep, hydration. So supplements are supplements, but there are some that are better than others. So number one is elderberry, and I'm not going to go into detail on the elderberry. I did a whole live segment on elderberry just the other day, so let me put the link for you guys for the elderberry section. Let me put that on there now. 1 second. Here it is. It's coming. It's coming. There you go. So there's my whole Facebook Live on elderberry. So I hope you'll watch that. It's an amazing, amazing, amazing preventative and also treatment for common cold, flu, that kind of stuff. So elderberry, number one. Number two is there is research on high dose vitamin C. So it doesn't really work as a treatment once you have it, but high dose IV vitamin C boosts up the immune system. We already know this. So my office definitely does IV vitamin C, but if you want to just dose yourself, I would do double the dose that's on your bottle. I prefer for patients to do bowel tolerance vitamin C. What that means is you're going to take a dose, and then if that doesn't give you GI upset or diarrhea, then you take double the dose. If that doesn't do it, then you take a third, take another dose until you reach that point. Once you reach that point, you back down one dose. That's bowel tolerance. Okay, so that means that's the amount that your system needs, wants, and can hold. So that pumps you up to the most amount of vitamin C that you can handle. So high dose vitamin C, elderberry. Vitamin A is fantastic for mucous membranes. Okay, so that supports your mucous membranes, and this is what we're talking about. This is how it's spread in the mucous membrane. So vitamin A, bump up your vitamin A. And then zinc. Zinc is just fantastic for overall immune system anyway, so get your zinc on. Number 6, and I know y'all have heard it because it's all over the news now. Like, I'm not really sure why we're not pumping up washing our hands anyway during cold and flu season, but it's like hyped up right now in the media about washing your hands. What I don't think that everybody is doing correctly is washing their hands correctly. So I'm going to give you a video on how to wash your hands correctly, and then I'm going to talk about it. Here's the washing the hands video. There you go. So the way to wash your hands is really you're supposed to do it for a bare minimum 20 seconds up to 1 minute. So here's how you wash your hands. First, you turn on the faucet and you wet your hands first. So you don't get the soap first, you wet your hands first all the way up to the wrist. And I think the video doesn't wet your hands up to the wrist, but you're going to wet your hands up to the wrist. Then you're going to get soap. You're going to lather the soap in your palm for a while until you get a really good lather. You're going to take your right hand and you're going to wash. Hold on 1 second. Sorry, hold on 1 second, guys. Sorry. Okay, so you're going to scrub the back right here, interlace your fingers so that you're getting the back of your hand. Then you're going to take your left hand and do the same thing, okay? Then you're going to do the palms of your hands like this. Then you're going to interlock your fingers and you're going to take your nails and you're going to scrub the back of your fingers with your nails. Do the other side like this. Then to get the pads of your fingers, you're going to rub in the palm of your hand like this. Can you see? And then do the other hand. Then you're going to rinse underneath the water. This should take you at least 20 seconds, if not a minute. Then you're going to take a paper towel. Now remember I said, if it's the type of paper towel dispenser where you have to actually roll it or push it and it's not an automatic dispenser, then you might want to go ahead and have that paper towel already down, because then you're recontaminating your hand if you have to do that. Pull out one paper towel and you're going to dry thoroughly. If it's not dried thoroughly, then you might still have some virus or bacteria on your hand. Dry thoroughly, take the paper towel, turn the faucet off, and then I'm going to suggest that you take that same paper towel and also open the door to let yourself out of the bathroom, because some people don't wash their hands after they go to the bathroom, and that's just nasty. Okay? So that's hand washing. I put a video in there for you guys from the World Health Organization, I think is where it's from. Okay, so then number 6 on my prevention treatment, how we're going to handle this, is stay at home. Guys, I know you have to go to work, but honestly, if you're sick, it's really better for you guys to stay at home. Convalesce, get your hydration, your rest. You're gonna get better, and you're gonna get better faster. So therefore, that's for you as an employee. For an employer, guys, don't make it so hard for people to stay at home. If you're an employer, please understand, if they say that they're sick, they probably need to stay at home. You don't want to infect the rest of the employees, right? If you have a child that is sick, how would you feel if somebody else's child came to school sick and then infected your child? So I just want us to be, a friend of mine, Dr. Walisa Vaughn, always says, let's do neighborly things, okay? So let's think about other people. Getting groceries. Maybe you don't need to be in crowded areas if you're sick. Order your groceries. There's Instacart. There is Shipped now. You can order your groceries. You can have your medicines delivered. CVS, I know, delivers medicines. So neighborly things is, if you know your neighbors, ask them to do things for you instead of you going out into crowded places when you're sick. If you know that there's somebody sick, do neighborly things, okay? So I'm going to recap really quickly, like I always do. So details. Coronavirus is a family of viruses that includes the common cold, SARS, which is severe acute respiratory syndrome, also MERS, which is Middle East respiratory syndrome, and now COVID-19, which is what we all know of as the coronavirus. A normal cell looks like this. A virus cell looks like this, has little spikes on it. The different spikes actually have affinity for different mucous membranes, so eyes, nose, and mouth, possibly. Normally, we build antibodies. If we have a great, robust immune system, we build antibodies. That's our vital force, or our body's inherent ability to heal itself. The antibodies then come and pull these spikes out so that it cannot attach or attack different places. This is a new virus, so therefore it's taking our immune system a little bit longer to build those antibodies. All right, that's why everybody's so scared. Let's see. It is symptoms, cold and flu. Think about body aches, fever, sneezing, cough, anything that you would think of like cold and flu. Severe would be shortness of breath. Let's see what else. There's no meds to cure it. There are no meds for prevention. If you're going to go to the hospital, they're going to give you oxygen because you've got shortness of breath, so it's going to be supportive measures. Also, they're going to give you hydration. Symptoms appear 2 to 14 days after exposure, so you should know that, like you've probably already been exposed. Some people have no symptoms, so do know that as well. It's spread through respiratory droplets, so if somebody sneezes or coughs, I forgot to tell you guys how to sneeze. So coughing and sneezing always needs to be in the crook of the elbow, like this, not out like this. If you're sneezing in your hands, you've got respiratory droplets on your hand, and then you're probably touching stuff, okay? So sneeze and cough, or either use a tissue. And even when you're using a tissue, you need to wash your hands afterwards. I also talked about washing hands, but I didn't talk about hand sanitizer. If you're going to use hand sanitizer, it needs to be at least 60% alcohol. All right. So those who are susceptible are patients that are over 65 years old, immunocompromised, so COPD, emphysema, diabetes, cardiovascular issues, people who are already fighting other things and their immune system is already depleted. So they're not making the antibodies the way that we would think that we need to make antibodies. Also little babies, because their immune system isn't robust and built up yet, and they tend to put things in their mouth, right? So the way in which we get this is respiratory droplets, somebody sneezes or coughs, like within 6 feet of you, it goes into your nose, your mouth, or your eye, or they've coughed or sneezed or somewhere and the virus is now on a surface and you touch it. If you just touch it, you're not going to get the virus. That's not how you get it. It can't go through your skin. You have to then touch your face, and it's going to go through your nose, your mouth, or your eye. Okay, that's how you get it. It has to be transported. These viruses don't have feet, they don't have hands, so it has to be transported. All right, and you transport it by touching your face. All right, masks. Masks, I don't think they're really working. So the masks that you guys are buying have little gaps on the sides and up here, so the virus can come through that, right? What it is doing is it's probably preventing you from touching your face, except for your eye. What it does do a good job is if you are sick, it's preventing you from throwing out your respiratory nastiness to other people as well. The mask that we think that does work and specifically is used for healthcare workers is the N95. So that one is completely sealed, usually used by healthcare workers. If you think that you have the virus, call ahead of time. Don't just show up at the emergency department. They're already overwhelmed. Call ahead of time to your family physician or another doctor. Let them kind of triage, and then you can decide whether or not you need to go to the emergency room so that they can be prepared for you. Cautions. Anything touch screen. If you're touching stuff, remember I told you it's transported when you touch it and you put it on your face. So touch screens at the grocery store, the movie theater, there's touch screens everywhere, like even when you go out to eat. If you're handing someone your credit card, they're taking it, they're touching it, and then they're giving it back to you. So anything in the grocery store for the most part, so the grocery carts, the grocery bags, the touch screen, just touching things in general. Gas pumps, that's probably something that you guys haven't thought about. Anything in the bathroom, cabinets, like if you're at work and you have to open cabinets to get paper or anything like that, the fax machine, communal things, water fountains, that kind of stuff. Crowded venues. So instead of a mask, I would suggest that you use gloves. Also public transportation, if you didn't think about that because you're holding on to rails. So natural prevention and treatment that I went through really quickly is basically the best cure is prevention so that you don't get it in the first place. You want to boost up your immune system because it's your immune system that's going to, can we use any kind of gloves, latex, etc.? Yes, if you have a latex allergy, don't use latex gloves, but use just the regular gloves that you can get from any kind of pharmacy, Walgreens, CVS, that kind of stuff. So you can buy a box of gloves. That's better than using a mask. So building up your immune system is actually going to help you make the antibodies. And remember, I said it's the antibodies that are going to pull out these spikes, right? And help you get back to this. You don't want the virus. You want antibodies are what are going to help you do that. You build the antibodies by building your immune system. Once again on how to build your immune system. 1, food as medicine. You can use food. I specifically like the blood type because it is a genetic-based diet. I put a podcast link in there already to the Duality of Vitality, where I just did a podcast where I talk about the blood type diet. Antioxidants. The best antioxidants in food are berries, are cruciferous vegetables like kale and broccoli. So building up your immune system using food, antioxidants, blood type diet. Decrease your sugar consumption. Sugar, if you eat it, is going to decrease your immune system for 4 hours each time you eat it. So decrease your sugar consumption right now. No processed foods. So shop the perimeter of the grocery store. That's where the deli aisle is, your live foods, and also your fruits, so your fruits and vegetables. So shop the perimeter of the grocery store. Hydrate. Flush the toxins out and alkalinize. Viruses, pathogens don't live in an alkalinized environment. They like an acidic environment. So you can do that with your alkalinized vegetables, also lemon in your water or alkalinized water. So hydrate, hydrate, hydrate. Half your body in ounces per day. So half your body weight. So if you weigh 140, you need to drink 70 ounces of water per day. Okay. Like I said, if you're going to the hospital, they're going to give you fluids, right? So hydrate yourself. Sleep. You have to sleep in order to build your immune system. When you're not sleeping properly and you're not getting enough rest, your immune system tanks. Okay, so sleep. Number 4, neti pot. It's a nasal lavage cleanse. So this whole area is EENT, eyes, ears, nose, and throat. It all has like different cavities and they're all connected, and then they go down to your lungs. So what you want to do is a nasal lavage, neti pot. So you put a little saline in the water, you do here, and it cleanses this passageway, okay? Because that's where the respiratory droplets might land, right? Supplements. So there's 4 that I talked about specifically. Elderberry is fantastic. I did a whole Facebook Live on it. I put a link into the comment section so that you guys can look at that. Vitamin C specifically, do double the doses of whatever you're doing right now. I specifically like IV vitamin C. We do that in my office. If you can't do that, then you can certainly do bowel tolerance. So bowel tolerance, like I said before, is where you're taking a dose. If you don't have gastric upset or diarrhea, then you take double that dose. If you don't have it that day, the next day you take triple the dose until you reach a dose where you have diarrhea or cramping. That day, after that day, you're going to back down 1 dose. That's your bowel tolerance. That's the amount of vitamin C your body really wants and can hold, and that's a good amount for you. Vitamin A is specific to the mucous membranes. So this is what we want to kind of protect right now, is our mucous membranes, because that's where these little things are attaching to. This is the virus, right? So mucous membranes, specifically vitamin A, and zinc, of course, is just great for immune boosting, period. Hand washing. I put a link to exactly how you're supposed to wash your hands, but bare minimum 20 seconds to 1 minute. This is how you wash your hands. Turn the water on, get your hands wet all the way up to your wrists. Get soap on your hands, lather in the palm of your hands. Right hand over left hand over the back part. Then left hand over right hand. Do your palms. Cup your fingers, take your nails, scrub. Scrub. Get the back palm pads of the fingers. Scrub. Scrub. Rinse really well. Take 1 paper towel, dry very well. Take that paper towel, turn the faucet off, use that paper towel, open the door. Okay, that's hand washing. And then 7, stay at home. If you're sick, stay at home. If you're sick, stay out of crowded environments. If you're immune compromised, stay out of crowded environments. That's public transportation, grocery store, concerts, those type of things. If you're an employer, be sympathetic and think about the fact that you don't want other employees getting sick. If you have a child, please be considerate. If you have a sick child, don't send them to school, because you wouldn't want somebody else sending their sick child to school. I hope that makes sense. Guys, do you guys have any questions for me? Because I've gone over it twice now. So if you guys have any questions, please let me know. I'm going to stay here for a second. I will answer some questions. Let me see if I can see if I thought I answered all the questions. I got the glove question. Let's see what else. I do not see any other questions. Thank you guys for joining. Share this if you can, please. All right. I don't see any other questions. So I'm Dr. Samm Price. I'm a licensed naturopathic physician. I'm an expert in natural medicine. Through my #1 best-selling book. Oh, I forgot. I created a whole document for you guys. Oh my goodness. Okay, let me give you guys the, all you have to do is you are going to text message the word immune. So it's a basic immune document. It's 8 pages long. It's all kinds of immune boosting stuff, more than what I just told you right then, some of my top secrets that I tell my patients. So you're going to text message the word immune, IMMUNE. It can be all caps, all lowercase, whatever you want to do, but immune, to 855-639-0646. So I will put that in the chat right now. Let's see. Text message the word immune to 855 what is it, 855-639 6390646. And you will get the 8-page document. Thank you guys so much for joining. I'm Dr. Samm Price. I'm a licensed naturopathic physician. I'm an expert in natural medicine. Through my #1 best-selling books, my concierge medical practice, my live event, Vital, The Experience, I help you bridge conventional and alternative medicine to transform your illness into wellness. Thanks so much for joining me, guys. Have a great day. Be safe out there. Wash your hands.